Okay, so while I pour some water, I need to think about, I have a few polling questions, so you can use your hands, and they're really broad questions. So the first question is, as I sort of I click the mouse towards my next slide, maybe this one. Oh, here we are. Is how do people feel about the use of AI within the NHS? And the caveat is that you don't need to be someone who works for the NHS. I'm just asking it as someone who's probably used the NHS. How do you feel about the NHS using AI? So hands up for I feel really comfortable with it. Okay. The light's in my eye, so I'm sort of seeing a very okay, so I'm sort of seeing about a fourth of the audience being okay. You might be fine with it, but so 1/4 of it. How many people feel really strongly that AI use within the NHS is a no-no? Okay, one person raised their hand. So everyone else is sort of. So everyone else seems to be undecided about it. So waiting for it. Okay, who's used AI in the past week or so? So hands up for who has used it. Right. Okay. So yeah. So you see the bias, right? So we all use AI on a everyday basis, and yet we have clear sort of views about how how institutions like the NHS should be using AI, and we're not sure because perhaps the communication around what AI is and the way in which it is used is not too clear. So last question is slightly loaded question, and is how would you feel if the care you received at the GP surgery level, so say the next time you went to your GP surgery for anything for that matter, that they had access to all the data that they have accumulated from your journey within the hospital and the GP surgeries at their fingertips, so that they could provide you with more individual care? How would you feel about that statement? That nice, warm statement. Would most people feel good about it? You can raise your hands. You can. Okay. So more people seem to be quite happy with that nice fuzzy statement, right? And it sort of shows you something that when you start speaking about something that is as something that's been in the media for so long as the use of AI, but you speak about it in its, but you don't share the context, that you can create quite a different response to when you share the context and when you sell what the outcome for the user will be, right? So if you take away, so one thing is that human beings are really responsive to these fuzzy statements because we all want to be cared for and we all want these tools to work for us, right? And if we don't communicate the way in which these tools work for us and for each other, you sort of lose the tool, right? So I hope I pressed the right, no, it didn't happen. So I work I work across the sector. So I work within the NHS as an epidemiologist who is interested in how you implement, I want to say, AI, but it's actually about how you implement some models within the NHS that use data. So I'm also, for my sins, a manager within the NHS. So I need to be able to make the decisions about patients, their movements. So I'm keen on sort of using the information that I have access to. But I'm not a modeler, so don't ask me questions about XGBoost because I might not know the answers to it. Now, what makes AI tick, right? So I think one of the main things that we need to think about when we think about AI is it's a really good word for something that we've all been using for a while. So mathematical models, they have been around for a really long time. And essentially, if you really had to get down to bare tax, is AI is essentially you can split them into two parts. You have deep learning. Now, everyone, I think, who put their hand up probably put their hand up for the use of AI because you use something like ChatGPT or you use Claude or you used something to do with that. So there is where you're using these large language models, right? That can make sense of the conversation that you give them, and then they can sort of look at how those sentences are structured, and then they can say something back to you which might or might not make sense. So much of the time, it doesn't make sense, but we use it. And then on the other side is the stuff that we've been using for a very long time, which is models which are based on stats, and these are more advanced models. So it's not as scary as it seems. But essentially what has made sure that we use AI in a much more, in our lives on a day-to-day basis, not just because you have the iPhone or the Android or, and that you have access to these LLMs on your doorstep, but also because there's a huge amount, there seems to be a huge amount of information which is made available. The computational power we now have in our mobile phones, in our computers, on the web server seems to be enough to make use of this data. And of course we have, and when I speak about the NHS, we have a lot of data that we collect as part of the NHS. But I have sobering news, and perhaps we should end it here, that healthcare information is not made for AI. And it's not made for AI essentially because healthcare information is not collected with the outcome of how we'll use this information for the patient. It is produced as a byproduct of care. And so a lot of the information that we produce within the NHS, as well, each one of you or myself sort of, we use the NHS is in unstructured formats, right? So formats that we can't make use of. So we have clinical notes, we have the antimicrobial notes, we have patient pathway notes. But so all of this is so that the clinicians and nurses and the healthcare assistants who are involved in your care can read it and make sense of your journey, right? But it is not ready for machine learning. So what do? I mean, so we can't well hang up the tool because actually, so AI and machine learning is here. So we have to think about how we can use this tool. And when I say a tool, I think one of the biggest things, or one of the biggest the prejudices towards AI, comes from the fact that it seems to be a tool that we've all been told that we should be using, right? Whereas I think it's much more favorable to look at AI as a change in the way in which we do things. So in order for the NHS, for that matter, or for clinical services worldwide to be able to use AI, you actually need a change in the system. And then what do I mean by that? I mean that you need a change in the way in which you collect the information and the way in which you can then use things like, AI, so within the portfolio of the work that are being done by the clinicians to help them, right? So rather than it be one more screen that you can use, it is something that can actually aid the decision making, right? And that's a lot harder than just seeing it as a tool that you should be using within the NHS. Now, when it comes to, so it's a busy slide, but perhaps you can take some pictures of it, because I think these are really good use cases for the use of AI and so within or using the data that not only we have within the healthcare service here, but in Europe. So for example, if you see, and I might just point it out with my little finger, and then you might have to follow it through, but if you look at, so bottom center, they've used automated surveillance in Denmark for quite a while, and one of the reasons why it has worked so well for Denmark is because they have a healthcare system which is regional down. So all the hospitals within, they collect the data, they then send it up to a regional network who then does the analysis and then sends it back to them. So what that means is you can run these models at the regional level. So what they have done here is using the data that is routinely collected, so the urine, the blood cultures, etc., to be able to look at how we can tag UTIs in patients. So it seems like a really good and simple measure, but you can see that if you need to use these models and if you need to use automated surveillance, how the caveat or the prerequisite is the fact that you need this whole system to be in place for you to be able to use it, because otherwise you're pushing the tool to look at data that you might have access to, which won't be the same. Now, looking at the top right, it's so work by Shapiro essentially looked at the data from the clinical notes and from the EHR systems, so the routine systems, to be able to tell us that actually patient networks and the accumulation of the antimicrobials at ward level is one of the biggest risk factors when it comes to AMR at patient level. You have examples of using ML to look at hand washing. So for anyone who works with the NHS or does anything, so hand washing is a big thing. And we've been pushing for good hand hygiene for so long. But the problem with hand hygiene is, well, it is hugely effective. But how do you follow staff to make sure that they're doing it well? Well, you can use these systems like you can monitor how well staff wash their hands at key points, and then you can use it as a marker for the efficacy of hand hygiene for that ward. And then you can overlay things like their use of the antimicrobial gel, and then you can overlay how many infections they have had over a few months, and then you can look at how does the use of the hand hygiene gel link with their use of or the propensity for infection. On that point, in terms of clustering, there is these are pretty pictures, but there's more to them. Now, most of you would be used to the picture on the right-hand side, which essentially is looking at patient the networks, right? But what we have done is we've been looking at the data from the patients that are semi-structured and how you can build the networks in terms of who has got an infection when and who are they linked to. Now, I've been shown the 1 minute mark, so I'll move on to something that is really fundamental. The UK, as of now, does not have the legislation for the use of AI. So essentially, each of the sectors which use AI are responsible for the use of this tool, so in their sector. There is a paper going through the House of Lords which will say something about the use of AI within the NHS. But guess what? The NHS has already started to use AI. So it's, so I'll leave you with this quote then, that I would love for AI to do my laundry so that I can do, do something so more profound than that. So thank you for your time.